we're seeing across our state. Just yesterday, we hit a grim milestone with 27 new deaths reported. Kathy and I are thinking about the family members and friends of all those who have lost someone to this virus. This is a grave, stark reminder for all of us in our state that COVID-19 isn't over. Our fight against this virus continues, and we know that now it's going to be harder than ever. As you all know, this spring we issued a safer at home order, and we had our state back on the right track. Unfortunately, Republicans in the legislature sued us over that order, and it was struck down by the Wisconsin Supreme Court. That means the difference this fall is that we're missing an important tool from our toolbox that we had earlier this year to try and stop this virus and keep people safe. And it's why, just as I've done over the last several months, today, Wisconsinites, I need to ask for your help. I know it's frustrating, I know it's exhausting, I know it's hard. You've made sacrifices for months, from your job to your schooling to other basic day-to-day activities. You're missing seeing friends and family. You're missing heading to the neighborhood bar to watch the Packer games. You're missing birthday parties and movie theaters and everything that comes with life as it used to be. I know, Kathy and I miss it too. But at the end of the day, whether we're tired or not, the longer it takes for everyone to take COVID-19 seriously, the longer this virus will linger. Right now, we can't live like we're back to the way things used to be. We can't afford to act like things are business as usual. We have to get back to the basics in fighting this virus. First and foremost, I'm asking you to stay at home. Cancel the play dates and the dinner parties. Tell your friends and family members you'd rather hang out virtually because you care about them and you want to keep them safe. Grab a six-pack to drink at home, grab your food to go, and head out only when it's absolutely necessary. You are safer at home. Second, if you have to leave your house, I'm asking you to wear a mask whenever you are out and about. If you're going to the grocery store, grabbing gas, or picking up a takeout, wear a mask. And remember that masks aren't a substitute for social or physical distancing. Just because you're wearing a mask doesn't mean you don't have to stay 6 feet apart. We need you to do both. The surges we're seeing across the state are not an indication that masks don't work. It underscores what we've said all along, which is that masks only work if everyone wears them. My mask protects me, protects you, and our masks work best when we're wearing them together. Wearing a mask isn't a political statement. It's a sign to strangers you see that you care about them, their families, and your community. That's why today I'm also going to call on our businesses, our retailers, and our industries, the folks who have been important partners in this fight all along. I'm asking for your help too. Public health is a team sport, and we know everybody wants to do the right thing and lead by example. Please do your part to keep our customers, our workers, and their families safe by following our mask order, ensuring everyone can socially distance, and help us get back to the basics of fighting this virus. Earlier this year, we all worked together to flatten the curve. We stayed home. We only went out when it was necessary, and we took care of our neighbors and each other. We face that challenge again today to prevent the spread of COVID-19 and work to flatten the curve so that we can ensure our doctors and our nurses and healthcare workers can continue to do their important work. I know these are difficult times. It's been a difficult year, and we have difficult days ahead. But I have no doubt in the grit and determination of the people of this state and the resilience we share when we work together. Thank you all for the work you're already doing and the work we all have to do together in the days and weeks ahead to keep each other healthy and safe. And now I'll turn it over to ThedaCare President and CEO, Dr. Imran Andrabi. Dr. Andrabi, you're up.
Governor, Thank you very much for inviting me. I couldn't agree more with everything that you have said. And I'll just bring a perspective from our communities that we serve as an organization. We have seen the same increases that you talk about. 4 weeks ago, I had 13 COVID patients in our hospitals. Today, I have 64. That's a six-fold increase in the number of people admitted. 95% of my beds are full. 250 of my workers today at ThedaCare, team members, did not show up for work. And it is not because they're getting infected while they are at work. It is because after a nurse has spent 12, 14 hours doing what she does, or a physician or another provider, we go out, and if everybody is not masking, you get infected or you get exposed to something in the community, and then they cannot come back to work and take care of people. Why it is important is because it is not only that we have to ensure that we are there to take care of the patients who have COVID within our communities, but we also have to continue to ensure that we are there for all the other things that people receive in the community as well. So we are still having people who could potentially have a heart attack, and we need to be there for them. And people who have strokes, and we need to be there for them. And people who develop a traumatic process, and we need to be there for them. And we need to be there for the women who need to get mammograms, and the kids who need to be immunized. And so if our people and team members are going to get infected and they're not going to be able to do the work that they need to do to serve the people of our community, then it creates a very difficult situation for us. So sometimes it's not just the number of beds that are available, it's also the people that actually serve the people in that bed. The other thing that I would say is the answer to taking care of these people who have developed COVID or are developing COVID is not to have more hospital beds, as the governor said. The way we actually can answer this problem or create a solution is by keeping ourselves more safe, by doing the simple things that may be aggravating at times, that may be difficult at times, the masking, the social distancing, not gathering in large numbers, now going into the flu season, making sure that we get the flu shot, making sure that you're keeping distance from somebody who may have symptoms, making sure that we are not having sleepovers, for example. All of those things contribute to the number of cases that we are seeing in our communities. And as the governor said, this is really a responsibility that we all have to take very seriously, because if some of us do it and others don't, it doesn't work. We all have to play a part. And my appeal to the people of Wisconsin, the leaders, and each and every individual would be, let's do our part, not only to keep us safe, but to keep our loved ones safe and to keep our communities safe. Handling COVID in ICU beds on ventilators and having the death rate that we had yesterday is not the answer to the problem. And we as Wisconsin and we as healthcare providers don't want to see ourselves on that list of the top 3 states in the country that are having the surge that we are having. So please help. Let's come together. Let's figure this out. And as the governor said, we've done it before and we can do it again. And let's follow the simple steps that we need to follow to make it happen. Thank you very much.
Thank you, Jennifer. Thank you, Dr. Andravi. I really appreciate you being here with us today. It is really so very important that we hear from you and from other healthcare providers on the front lines of this pandemic. I'm going to start today with the data because I want to make sure that we're painting a thorough picture for you of the realities we're facing here in Wisconsin. So here's where we stand. As of last week, 72 out of our 72 counties reported a high case activity level. This week, we updated our local data dashboard to provide more information to community decision makers about the status of COVID-19 in their counties. Part of this update included adding a new very high activity level, and as of today, 45 of our counties meet this threshold of the very high activity level, which means that there are more than 350 cases per 100,000 people in that county. 41 of our counties in Wisconsin show a growing trajectory, indicating that cases are on the rise. Wisconsin as a whole is also at a very high activity level and a growing trajectory of cases. There are now 125,161 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 2,887 over yesterday. Our 7-day average of new daily cases is 2,405, which is up from 727 1 month ago. Our total deaths have now reached 1,348. As you know, yesterday we added 27 people, our highest single day to date, to the list of neighbors and friends we've lost, and today we added 21 more. Our hearts go out to the families who have lost loved ones to COVID-19. This is what we're facing here in Wisconsin. COVID-19 is a highly infectious disease, and it is spreading in our state. It is stretching our hospital capacity, and it is overwhelming our public health infrastructure. We must take action. Today, Governor Evers and I signed Emergency Order Number 2 to allow healthcare providers licensed in other states to practice here in Wisconsin. While I'm grateful that we were able to take this step to facilitate additional staffing support for our healthcare systems, I'm saddened that we needed to do it. However, due to the surging hospitalizations and staffing shortages, it is a step that we must take. Yesterday, Governor Evers and I made calls across the state with local government leaders, local health departments, and business leaders, and our calls continue today. We're asking these leaders to take action to help stop the spread in our state by implementing policies in their communities and their workplaces. We'll continue to do all we can at DHS to ensure local leaders have information and tools they need to make well-informed and data-driven decisions, like the updated data dashboards and the new mitigation strategies guidance that we also released yesterday. We commit to providing these tools, and we need local leaders to commit to taking action. And that goes for all of us. Each of us can take action to stop the spread. We can wear a mask and stay home as much as possible. If we have symptoms or have been exposed, we can get tested. And we can be sure to quarantine while waiting for our test results. We can challenge misinformation and make sure to encourage our friends to take precautions like physical distancing seriously. And we can reach out to family members because staying connected, even virtually, is so important right now. Wisconsin is at a critical moment in this pandemic, and we each need to double down and help stop the spread.
You.